Welcome back, folks. Hope you enjoyed your stretch break and you're feeling a little bit more limber now. Next up, I'm really excited to introduce Dr. Teresa Penbrooke, whose career has included over 30 years of private and nonprofit business management, teaching and research, including time as a Parks and Recreation Agency administrator and program coordinator for 3 different public agencies in Colorado. Teresa has been in the field doing the work, and she now authors books and articles and teaches for universities and national associations and does the research and consulting, kind of keep that work moving forward as a field builder in the world of outdoor recreation and public health. She focuses on quality of life systems, planning and management, leadership, access to nature, and really kind of the operationalizing and strategic planning around these connectivities, both as director of the Healthy Communities Research Group and faculty for GP Red, which is a national nonprofit dedicated to research, education, and development for health, recreation, and land management agencies. She's also the CEO and founder of Greenplay, which is a leading national private parks, rec, tourism, and open space consulting firm. Long story short, she's an OG. We're so glad to have her here with us today. And I'll turn it over now to Teresa Penbrooke. Dr. Penbrooke, the stage is yours.
Well, thank you so much. I am so happy to be here today. And this is it's been just a wonderful lineup. As you said, I've been in the field for a long time, and I actually started back in the 80s as an outdoor recreation leader. I was with the city of Boulder. The adventure program was my first paid job in the field, leading rafting and backpacking trips and climbing and all sorts of fun stuff in Boulder and learning logistics. And then I finished my undergrad in kinesiology and started getting fitness and health. And so I started on the health track, and I was really working at that individual level. And then as I got more involved, I got a master's in organizational management and now my PhD in parks, recreation, and tourism management. But throughout that time, the outdoors is my heart. I've run the Grand a couple times. I've been out every day. I try to get outdoors, and the more busy I am, the more I realize that we need this. And so the thing I've learned today so much is just how far we have come in the last 25, 30 years since I've been in the field. I remember attending a conference that was somewhat titled something like this back in 2008, and I was coming from the recreation lens, and I was really frustrated that we didn't have a whole lot of recreation people involved, even for-profit or local government involved. It was a public health kind of conference, and I think since that time, as you could tell from the previous presenters, we have just made amazing strides. So some of the things I'm going to talk about today may be a little bit of duplication of what you've heard from some of the previous speakers, but I'm kind of summarizing it from a different lens. As a person who's been in the field, both as an outdoor recreation leader, guiding services, running businesses in that realm, but now in working with local government, I did that for a long time, and then working now, trying to figure out how we determine what communities need. So I'm going to go ahead and share my screen. I'm a little bit of an academic now that I have my, let me see if I can get this from the beginning here. There we go. Now, so some of these slides are going to look a little bit academic, and that's kind of on purpose, because I think one of the things that I'm hearing is this thread today is we want to give you as much information as we can so that as you are working, whatever your role is, I know that we've got, private business providers here on this group. We've got people who work in local government. We've got people in the nonprofit or the public health realm. So we've got all of you out there doing different things around this idea. And so what I want to do is try and bring together the things that you've heard earlier about the evidence base, about the social determinants of health, all of those different aspects, but how do we turn that into which programs we provide and how we provide them? So the focus is really going to be looking, my dissertation when I got my PhD was looking at parks and recreation as preventive public health providers. So combining the two, marrying what we do in outdoor recreation and recreation overall with how we look at that through a preventive public health lens. And so when they asked me to do this topic today, I really wanted to delve a little bit more into some of the nitty-gritty tools and tactics to use. And some of you may say, well, these are not things that I can do. What I hope to do is kind of teach you the language so that if you are not in a position of offering some of the things that I'm talking about today, you are in the position of knowing what to ask for, knowing how you fit in, and especially around this idea of breaking down barriers to access. One of the very first things I did as an outdoor recreation leader when I was working for an agency in Colorado was I had to kind of go to bat to get us permitting access to trails on the National Forest Service lands, because the outdoor hiking trips and hut trips and all those things that I was leading at that point we couldn't get access to Forest Service lands. And so barriers to access come in a whole variety of ways. And so as we're talking today, I want you to think about, and in your questions, feel free to ask questions, whether it's coming from the side of getting access to lands from the work that you're doing, or whether you're trying to help, we're trying to help the community get access to outdoor recreation and nature, all of these different aspects, because I truly believe that what we do is crucial more now than ever. So I'm going to talk about a lot of different elements. Just to kind of I know Dr. Rosani gave a really nice overview of the evidence base. And so I'm just to summarize here, we know the evidence is clear. So there's no need for us. I mean, research is coming out every single day that we know spending time outdoors in nature strengthens our immune systems and can increase social cohesion, the social engagement. We are the answer. As little as 20 minutes a day can be very helpful. We also know that exposure to sunshine gives us, enhances our immune systems, especially through vitamin D production. We also help synchronize our internal body clocks. We sleep better. There's a really great body of evidence around this whole idea that the volatile organic compounds given off by soil or trees or plants really help us enhance our immune systems. And so the one thing I'm really interested in, I'm a water person. So as you see here, I've got my blue heron in the background. I'm actually at the Crystal Coast in North Carolina right now, but my home's in Colorado. And I know that I've learned for myself that I'm a beach water person. My husband is a forest person. And so we combine our lives so we can have the blessings of both. But think about that in your own self. What is the most important thing for you to get your own self out? And then how do you package that? How do you help everyone frame that? And so the people that you're working with understand the environment that is most beneficial for them. We do know that walking can reduce our stress, anxiety, all of this stuff. So I'm not going to spend too much time on the research. There are lots of graphics, and my presentation slides are freely available. Feel free to use them. I know that some of the researchers that I'm citing here are actually in this conference, and so I'm very honored to have them listening in. Bottom line is, we know that having access to nature or access to outdoor spaces really provide all of these benefits. So I won't run through them, but the mental health benefits, the physical benefits, the social benefits have been proven over and over again. And so if you need more research, there's all sorts of citations, and I'm happy to provide more. But bottom line is, it's been proven. I come at this from a lens of public parks and recreation. Even though I started in private sector and I've done a lot of private and nonprofit work, what I really am interested in is how do we help our communities be healthier? And so we know that public parks and recreation agencies provide parks and recreation facilities for over 80% of the people out there. So they own and manage the lands that we want to have access to. And so if it's not in your own backyard, usually it's owned by a public agency. And so what we want to do is we want to facilitate opportunities to get out and get access to that. We also want to have make sure that it's equitable and the programming is affordable, and so that everyone within every community that we live in and represent can have access. I was lucky to do a project for a recreational wellness plan for the National Science Foundation back in 2009. And this, right back then, they realized that even in Antarctica, they create a kind of a temporary community every single year on ice. So some of you may have been there or know about that. But this graphic shows the idea that, we all come at wellness and health from different aspects. Obviously, we need the medical care. And I am so glad that the medical community and Dr. Shani and other folks are involved now in this idea that we have to have access to medical care. We obviously come at this from our own desires, like I talked about, whether you like water or forest or rose gardens or desert and stone, all of the different minds that we have. We're coming with a basic preference, but we also have to feel safe. And so one of the things we're looking at is this safety and the security of the living environment so that we do feel safe to get out in the outdoors. And that's a big issue. We also have to have good food to eat. So obviously nutrition is a piece of this. And then we know that this recreation, or what I like to call recreation of body, mind, and spirit, is crucial for mental, social, physical, and often spiritual activities. The lands that we provide, the access to trees, there are a lot of people, that's where they get their spiritual basis. And so we want to make sure that we have that. So all of these graphics that I provide are designed to give you ways to frame this to the people, the decision makers in your community that you're talking with. Out of my dissertation, this is kind of a busy graphic, and you saw a similar graphic from Robert Woods Johnson earlier. We talk a lot about the social determinants of health in public health. And what I wanted to do was make this a little bit more accessible for the layperson or for public parks and recreation who don't have a public health background. And so created this graphic to talk about factors. Now, factors can be determinants of health. They can be a variety of different things. But if you look at this graphic on the left-hand side, basically we've got those modifiable factors. These have been shown through research that we can actually improve or affect through parks and recreation system planning. So we've got, for purposes of this graphic, I have parks and recreation and strategies at the top, just not they can be anywhere on here, it can be rotated. But we have to have that access to safety and or perception of safety before we'll go out there. There's a whole lot of work right now around, you know, the disparities and why we see differences, racial differences in use of the outdoors. And for those of us who grew up in the outdoors, and especially with privilege, you know, it's not always obvious to us that there are a variety of cultural aspects and a variety of other pieces that make the outdoors not feel safe. And so one of the first things we have to do is look at, is that a barrier to access? Are people not going into the outdoors because they have either grown up with an idea that it's not safe, they're just not familiar, or they just truly don't have access to nature or the outdoors? This social and parental engagement is a factor that will really determine whether somebody does activity. Can they get there? Is it available to them? So we look at transportation and access to. I talked a little bit about nutrition, but also knowing that there's a whole body of work right now. We know people who are in the outdoors are more physically active, they eat better, and they are healthier overall. So if you look at that whole left-hand side as kind of the modifiable factors of spaces and programs and things that we can affect. And then on the right-hand side, we've heard a lot about relationships. The whole idea of all of these people, the medical, you know, the doctors, the public health folks, all of the for-profit and nonprofit partners, all of the providers that are out there. We have to partner with schools and education, and we have to have the latest and greatest research. And so I created this graphic to really show how these things all work together. And so I don't know which bubble you're in as you're listening to this and which lens you're coming from, but wherever you put yourself, the bottom line is we're trying to get to this idea of preventive community health, or the improving our access to the outdoors, removing the barrier so that we can all be healthier. One of the ways that we do this, so Greenplay is a for-profit management consulting firm, and we've done over 600 community system plans since 1999 when I founded the firm. So we work all over the country, and we've been working virtually since 2010. So this new aspect is not that big of a deal for us. But the idea of looking at every community from a master planning standpoint, and you heard earlier the talk about community health needs assessments, the community health improvement plans, all of these different plans that are coming from the public health realm, which are incredibly crucial. And what I want to spend a little more time talking about is the other part of the planning that happens at the government realm, which is the master planning, comprehensive planning that has to be done. So I'm going to present it from a national level because we work nationally. GP Red is really the research and education arm that's sponsored. So I actually work for both organizations. That's why you see both logos. But with Greenplay, we're working on community-specific plans. And then with Red, we are aggregating that data and teaching across the country. So I'm here on behalf of both, actually, right now. We've done a lot of work in North Carolina, but we've also done quite a bit of work around the country. So these are just some of the agencies where we have actually started to see funding for healthy communities, parks and recreation master plans. And so most parks and recreation agencies have to do a system plan at least once every 5 years in order to qualify for grant funding. And there's different qualifications around the country. There's different things at a local or county or state or national level. There are different requirements, but almost every agency has to have a plan. And so the big improvement that we've seen in the last 5 years is that we're starting to see these plans funded in part in collaboration with public health and or insurance companies. And so a lot of these communities that I have their logos here, their parks and recreation plan was funded by either insurance. A lot of insurance companies are now getting it because insurance companies, as we'll hear from our funders, they understand that if people are healthier, there's a cost savings there. And so there's really starting to see this change in the system and master planning. And wherever you are, whatever bubble you fit in that last diagram, you want to be part of that planning process because you want to make sure that your voice is heard. one way that we look at this in terms of systems analysis, and I'm not going to go through all this detail, but is we have to ask the basic questions. Why are we doing this? Who are we impacting? And that's the very first piece. We call that warrant for agency action. Why are we even doing a planning process? Why are we looking at access? Why is this important? Then we have to bring everybody together, and that includes, everybody from the community, diverse representation, looking at all the policies. I know I've seen some questions around policies, and so we want to look at the policies that have been in place already. Are any of those policies actually causing a barrier, or are they, helping people get into the outdoors or helping people be more active? And we want to look at the fiscal, the money. Is there money available? And that's often a common constraint. Nobody has too much money. So we're looking at this whole idea of both direct and indirect fiscal resources. How are us getting people into the outdoors, or us getting people active? What is the return on investment for that? So you starting to use that business language, because a lot of our funders are coming at this from a business standpoint. So if you haven't thought of it and framed it in that way, beyond just the evidence base, we all know it's good for us, or you probably wouldn't be participating in this conference. We know it's good, so now we have to be able to show and document. And we also have to do this inventory piece where we have to find out what's there. To do that, the first step, and I'm just going to run through these steps, and I'm calling them tactics and methods because they're crucial. And so if you think about in whatever community you're working in, or if you're working in multiple communities, do they have these steps already done? Have they been done in the last 5 years? So this is just an example of making sure that before we ever start, we want to make sure that we know who lives there. So we can it's pretty easy to do demographics analysis these days. A lot of the stuff you can Google right online. A lot of times our agencies will have, we use a service through Esri where we can get very detailed projections of, all different types of demographic analysis. But just make sure, my bottom line here is make sure that you have it, because even within communities, we are seeing disparities between certain sub-areas. And so we often do what we call sub-area analysis. And this is an example from Hutchinson, Kansas, which is a pretty small community. I think their population, I can't remember the population, but they've got, they've got very disparate sub-areas within the city. So we want to know that right up front, because if we're looking at how we get people out, how we provide access, we want to know what the income levels are, what the racial breakdown, the age levels, all of those things. This is just from Hutchinson. If we start looking at the idea, we want any kind of planning process to be representative of the people who live in the community, because we have to have, in order to break down barriers to access, we have to make sure that there is a trust factor. And so making sure that we know the difference there. I'm hearing some background noise. Is there? Okay. I'm sorry, are you asking me a question? I'm hearing a lot of background noise. I'm hoping that might just be a microphone. Okay. So we just want to make sure that you have a full understanding of what the diversity is. This was another community that's completely different than Hutchinson, Kansas, and we're working in Stonecrest, Georgia, just finishing up their overall community plan. And they are 94% African American. And those are kind of like the two extremes. But my point here is just to show you, whatever you do, please make sure that you are looking at all the different aspects. So once we know what the community is made up of, then we want to make sure that we have ways to get to people. So we use what we call a mixed methods approach. Andy or Noah? I can hear a lot of background noise. I don't know if that's one of your microphones. Okay, thank you. So we want to use a mixed methods approach, which includes not only the typical ways that we reach people through public meetings, but also in interviews with different people. But we have incorporated technology a lot, and especially now with COVID, a lot of our projects, we use what we call mobile optimized engagement, and we're actually seeing increased participation with folks because they can participate from their couch on their phone. And so there's a whole lot of different ways that we can get information gathering, but my encouragement here is just to say this is a tactic that you need to think through. At the beginning of every kind of effort, we look at what is the engagement protocol and how are we going to go to people on site? Are we going to do it all mobile? Are we going to do a survey? all different types of things. We also use some techniques to actually prioritize. So these are some of the transportation includes access here on this slide. So looking at, the idea of in a given community, which of the factors that I talked about, which of the social determinants of health are the most important. And so we use what we call a multi-attribute utilities technique with a focus group of people who live in the community and asking them, asking the knowledgeable folks, what is going to be the most important? It doesn't show it on the slide, but I often include access to nature. Sometimes we will include drugs and alcohol, some of the other factors that can be priorities in certain communities. But what we do is we go through and do an iterative process to make sure we find out what people want. We always do what we call a statistically valid random survey. We don't do them in-house, so I always hire that out to a company that's what they do. And we actually can ask all different types of things. We want to find out the true value of what's going on in the community. And so what we've started doing, though, from this idea of healthy communities and outdoor recreations, we've started asking. And so as you see, this is just an example from, I think this was Fruita, Colorado, yes. Basically trying to have the public prioritize what is the most important for them. I will tell you that in these surveys, almost always, the most important thing that comes up is trails. And so if you are working around trails and greenways, almost always that's the number one supported aspect in communities. And so depending on what it is, the bottom line is we want to know so that we can really help address that. And if you are coming at this from a standpoint of owning a private business, you kind of want to know where you fit in on this. How is what you're doing going to contribute to the goals and the needs of the community? We often ask the youth. So this is we have a youth activity and nutrition survey that we do with middle schoolers, and it's an online survey, so we can actually find out how active the middle schoolers are. How much time they're spending outdoors, how much time they're spending on their screens. Do they feel safe in their communities? Are they able to get from where they want to be to where they want to go? So do they have options for active transportation and those types of things? Do they have good social engagement? Is the modeling? Do the parents help them get out? And so there's a whole bunch of different things that we can find out, and that will help support or help us address what we want to put forward in terms of getting funding and making things more available. The biggest improvement in what we do since the last 15 years has really been the use of GIS, so that when we talk about an inventory, we call everything that's owned and managed by a public agency a component. So and a lot of times we're talking about access to active components like playgrounds or ball fields or dog parks. But we also include natural components, access to watersheds, blueways and trail entry points. So trails are a big part of this. So anything that is owned and managed within the community can be inventoried. And then we can look at not only do they have that, do they have something in a place that you can get to, but also what is the functionality of that? What kind of shape is it in? What's the quality? Can we walk to it versus driving to everything? What types of programs are offered? And then the latest iteration of this is really this idea. We now have proven evidence-based active energy expenditure values so that we can actually tie in, if you have a certain trailhead, certain number of miles of trails, how many METs, how many calories people are spending on that component. We can actually track that through direct observation or projection, depending on what we're trying to do. So I'm showing you a ton of stuff here, and I know it's probably a little bit overwhelming. But part of what I wanted to do was show you there's so many tools to help you make the case at this point in time that we can really bring them together. And I could talk about this stuff all day. It's really exciting. But what it does is it shows the decision makers where the needs are. So if you're looking at putting in a canoe launch or starting a livery service, or you're looking at whatever it is that you're interested in doing, we can help make the case for why that's important, how people are going to get there, and how it's going to help in the community. These are just some examples of walkability. My big piece here was just to show that barriers are one thing that we have to pay really close attention to. It's not enough just to have a 10-minute walk program anymore. We have to make sure that people feel safe, they're aware of where the things are. Awareness is a big issue, and people won't go to places that they're not aware of, or they won't cross busy streets, they can't cross rivers, so that type of thing. This is just another example. I talked about Fruita earlier, but Fruita, Colorado, if you're familiar with it, it's kind of like the international mountain biking capital of the West, and it's got amazing trails, but there's an interstate going right through the middle of town. So if you're staying on one side of town versus the other, if you're staying on the north side of town, it's really hard to get across that interstate to go to the south side of the town where all the trails are. And so what we're looking at right now is how do we make that easier? Is it something where we need an underpass? We need a bridge? How do we make it so that the access is not truncated or cut off by different barriers that are in the way? We also want to really make the case. I know that Dr. Lincoln Larson, he was with me at NC State. He was part of this work where they did a big study on the 606 Greenway in Chicago, and he's looked at a variety of different things around health and parks and recreation and crime. But the point here is that the evidence shows that by strategically putting in trails, we can reduce crime. We can actually have benefits. So the stuff that we do in outdoor recreation is giving us benefits way beyond getting people into just happy outdoors. Even though that's an incredible thing on its own, we also are having impacts in other ways. And so there's a lot of good work here you can delve into if you're interested. Really good stuff. Looking at, reducing property crimes, all sorts of different stuff. We also can look at how we tie into the idea of economic and financial impact. Most of the things that we own and manage in the public sector realm, there's a whole lot of impact. And so whether it's a unique natural feature, whether you have access to waterfalls or beaches or other different places, how we tie into the historical pieces. Can we do a trail that kind of does a historical route? What are we drawing from? Can we have events around different natural features? And so there's a whole lot of different ways that we can look at the economic and financial impact. I know that there are representatives from the Outdoor Industry Association. Hi, Lisa, I saw your name. There's a whole lot of folks looking, at, and this is an older slide, so I'm sorry, I don't remember what year this was. But my point here with this slide is that we know that outdoor recreation is an economic giant. And I know that the upcoming sessions in the conference are going to talk a lot about that. But we want to make sure that we integrate that into making sure that as we're trying to overcome a barrier, that we are constantly presenting and framing all of the benefits that we do for the consumers, for the residents in our community. So use everything that's available to you and make sure you go to those sessions too, because that's going to help a lot. This whole piece of making sure that we're doing gaps analysis. So if you're trying to put in or help put in some sort of service or something like that, are you helping to fill a gap? Can you help make sure people are getting to a place, and whether it's trying to get under-resourced youth out into the outdoors, whether we're trying to get people on a van trip from one part of town to another part of town or into the forest. I know we did the Children's Forest Corridor project with the city of Denver, trying to get inner city youth up into the mountains, which are only an hour west, but it was amazing how many of the kids had never been in the mountains. And so the whole idea of, can we get them to the beach? Can we get them to the areas that actually exist rather than just having those areas kind of reserved for people who already have good resources and can get around? Just to kind of, finish up here, I wanted to summarize a little bit. Everything that we do comes with the idea of an action plan. So as you're working with agencies or you're working in your community, the very first thing I'd say after all the stuff I've been presenting is, number one, find out, does your community have a comprehensive, sometimes I'll call it a comprehensive master plan, a strategic plan, whatever that is. They have to have an overall umbrella plan, whether it's at the local level, county level. If you're in a rural area and you don't have a lot of municipalities, they may not have one, but they typically will have one at a county level. Or definitely every state has to have a SCORP to qualify for land water conservation funds. And so then at the federal level, every single element of the National Park Service and the National Forest Service, they all have recreation management plans. My point here is for you to realize that if you're trying to get access to or help people get out in or provide a service, as you position what you're doing, make sure that you're fitting into an action plan and that you're part of that conversation, so that what you can do is directly take, here's what we provide and here's how we help you meet this objective. And that, because look who's involved. And I think the biggest takeaway, even for me so far today, is how far we have come in terms of our various roles and how well we can work together. The fact that we're having this incredible conference and you've done this group, it's bringing everybody together. I think is so crucial, because then we can talk about shared responsibility. And I know, I can't remember if it was Emily or Aaron, somebody earlier said, the reality is that none of us can do this alone. This whole idea of how we get people into the outdoors and how we improve health is way bigger than any one of us. And so the point here is making sure that our action plans are aligned, and that our timing and our outcomes are really, we can show that we're working towards things. And I guess what I would ask is, we're starting to look at questions for today. I'm happy to answer questions on the whole bunch of stuff that I just provided for you. I can go into detail, or we can talk a little bit more about anything that's going to help you. If you've got an issue, you've got some sort of barrier to either doing what you're doing in your own business or your own agency, or if you've got barriers in your community, what I'd like to do is talk about that a little bit. And so I wanted to leave some time here at the end to just ask that. And I didn't do a poll, but I figured you could ask that in the chat, and then hopefully Andy and Noah can help me with your questions, and I'd be happy to answer those. The bottom line, though, is that you just want to make sure that you're part of this approach. And we often recommend a toolkit approach. So I'm not going to go through each of these steps because I just did. My summary slides are available for you. And so what I would consider is that as you're looking at anything that you do, figure out which piece of the toolkit or the steps or the tactics that you should be part of. What is it that you need to be able to help get your action forward? And then you might be part of the reporting and the evaluating. You might be part of the working with the medical community, or working with the insurance companies or the other funders. Or you might be part of actually offering on the ground services to individuals and families. So whatever your role is, there's a place for you within this step. And so learning that and being able to go forward and create those relationships, keep hearing that word today, but create those relationships so that you can really be part of the process. And so I'm going to stop there. I'm going to leave my contact information up here. And then what I would love to do is have Andy and Noah kind of help me with any questions that have come up, because I can't see that on my...
Sure thing, no problem. We are right here for you. And so we have a few questions coming up. So the first one is that someone's interested in dismantling myths about the outdoors. What are ways we can communicate accurate information about the outdoors to help break down barriers?
I'm having a really hard time hearing you. Could you talk a little louder or closer, please?
Sure. This person's interested in dismantling myths about the outdoors. What are ways we can communicate accurate information about the outdoors to help break down barriers? So more accurate information about the outdoors and communicating that effectively. Did you hear okay there?
I cannot. So maybe if can you put it in the chat feature?
Let me try one more time. We're working.
Yeah, there you are.
There we go. Okay, sorry about that. All technology is getting figured out. So
No
this
problem.
person's interested in dismantling myths about the outdoors. What are ways we can communicate accurate information about the outdoors to help break down barriers?
Okay, communicate. And I think the idea, number one, is to be aware that the first part is just be aware there are barriers. And so by knowing who lives in your community and knowing what those barriers are, then you'll be able to kind of tactically address each one. And it's different. And the one thing I know, it's different in every community. So I don't want to be too general. But if it truly is it a physical barrier like a highway or a river in the way that we just can't get people to places? Or is it a safety or perception of safety barrier? That piece of, there's so many different types of barriers. I mean, if it was easy and there were no barriers, everybody would be doing it, right? Because we all know outdoor recreation is great for us. And so if people are not doing that and you're trying to increase it, think about what is it in your community that is stopping them? Sometimes it truly, and that's why that action plan for us, I never come in with an idea that it has to be this program, or that thing. When I did my dissertation, I actually did a national study, and I asked agencies around the country to help me prioritize what is the barrier, what is the thing. And the one thing I learned is that it's community specific. It's different all over the country. And so it's not, sometimes it truly is just, I used to call it the program of the day. Back when there was a lot of funding at the federal level, there would be a lot of programs that were funded, and we could participate in that, and we could get money. Those federal programs have, at least in the last 4 years, have kind of been, they've kind of dried up. And so the money is not coming from the national level. There's not as many programs to take advantage of, but we still have a lot of barriers. So is it truly that you need an underpass or an overpass on a physical barrier? Is it truly that it's transportation? we can't get the kids from inner city Denver into the mountains because they just can't get there. So I know it's kind of a vague answer, but it really does come down to you have to figure out what the barrier is. And then there are all sorts of strategies that we can use. Sometimes it's physical, sometimes it is programmatic, sometimes it's policy, sometimes it's funding. But figure out what the answer needs to be, and then we can all work together to address it.
Awesome. Thank you, Teresa. That's really helpful. And I think one barrier people are asking about in particular is the digital barrier, right? This perceived barrier that our phones and our computers keep us inside and keep us from going outside. I know my couch and my phone are a problem sometimes, right? When it's a beautiful day outside. What are you seeing that's working to help address that?
Well, it's interesting. I mean, it used to be, we do a lot, like I said, we do a lot of mobile optimized and a lot of virtual stuff. And the argument used to be that people from under-resourced communities didn't have access to computers. But what we know now is that people, 86% of adults in the United States have a smartphone. And so what we're seeing that if, as long as we're really addressing that at a level that is, the language is appropriate and we are, making sure that it's widely advertised, that barrier of access to digital information is not as big of a deal anymore. In fact, in some ways, we have seen really strong increases in participation from people who would never come to a public meeting because they just didn't feel comfortable. So that removing that digital barrier is there. But the other flip side of that is, as you all know, screen time has gone through the roof, especially with COVID. And so the barrier there is how do we use that tool? And I've heard, I've watched The Social Dilemma. I know all about how bad our phones and our screens can be for us. On the other hand, I think that if we use them wisely as educational tools, we can really use them to get people in the outdoors. A lot of our parks, and even the national park level, are starting to ping people when they have their phone in a public area. They'll say, hey, stop, look around. And so you can actually use your phone and create apps that will get people to stop and look at what's going on in their community. And there's all sorts of different examples of innovative ways where we are tapping in, and rather than fighting, we don't want to, for a while there, it was like, we don't want internet in any of these parks. That's just ruining the whole experience. Well, people are going to be on there. They're either not going to go to the parks if they're addicted to the digital age, or we can take advantage of that and we can help them really learn. I love the Audubon apps. I love all sorts of apps where any place I go, there's a lot of Cotrex in Colorado. Wherever you go, there's crowdsourcing, and it can tell you, go find this cool thing. So rather than looking at the digital age as something that we have to continue to fight against as if it's taking something away from us in outdoor recreation, let's use it. And if you truly feel like you're in a community where parents are not letting their kids go in the outdoors, or there's a reason that's a barrier, then embrace it, become part of it, create your Facebook page, create your, whatever, there's all sorts of different apps, and I don't have time to go into them today. But embrace the digital age and use it as an innovative way to get people into the outdoors and pique their interest, especially if they've never been before. Make sure that they can see how cool, like in Chapel Hill, North Carolina, great example. One of the, they had a lot of kids who, just had never been in the outdoors, never did anything. And they had a really good outdoor rec, they have a really good outdoor rec programmer. And what he was doing was he was just kind of videoing himself going around doing really cool stuff outdoors. And all of a sudden, the kids were like, well, I want to do that. And so he was able to bring people into the outdoors who didn't even know they could. And, places like in Arlington Heights, in Illinois, we had a youth meeting, and the kids are like, oh, there's nothing to do here. All we do, and they were just really bemoaning. But the second we started talking about the potential of extreme, what some people consider extreme, kayaking, climbing, ropes courses, bike courses, all of these things, which are sometimes classified as extreme outdoor recreation. As soon as we started talking about that, the kids lit up in that community. And so we actually ended up there, and in Hutchinson, Kansas, ended up recommending what we called an extreme park. For most of us in outdoor recreation, it wasn't really extreme, but it was very safe, but it got kids to feeling like they could participate in those really cool things. And those are the activities that are growing like crazy. So I would say embrace it.
That makes sense. Yeah, it's like, it can be a divide if you let it be a divide, right?
Yeah,
if you see it as the enemy, it will be.
Good.
Yeah.
Yeah.
Yeah, and it's interesting. It reminds me of two things. One of them is Pokemon Go, which is dropping
Exactly.
more folks outside, right, in all kinds of public parks and et cetera. There's some cool examples. It's nerdy, but augmented reality is coming, right? It's already happening. And he's got kids,
Right.
He knows, right?
And we saw kids, I mean, the physical activity that came from Pokemon Go went through the roof. And so if you're using something like, if you see something like that happening, and everything has a good and a bad side, embrace it and then use it for the good, you know?
Yeah, I think that's really a lesson we should take back for all these different pieces, is when you see something, there's almost nothing that's one-sided. It's really easy to have your hackles up and turn off your opportunity thinking, because something one-sided shows up and you're just like instantaneously like, you know, get that grimace. And it's that moment of pause.
Yeah, I mean, one last thing I was thinking, I think about this a lot, you know, this whole pandemic, and there's a whole lot of stuff going on right now in our nation that's really negative. But on the other hand, we are seeing use of the outdoors is skyrocketing. Use of parks, if you use Google Analytics, in almost every single state around the country, the use of parks and outdoor recreation lands has skyrocketed. So it's really, I think, an opportunity for those of us in the field right now to capitalize on that and say, capture that data, to be part of it and share that and say, you know, our public, our community, our users, our customers, they want what we do. And so, and it's become more and more apparent because of the pandemic. So I think now is a great time to use that and share that with our decision makers and make the case that we are essential in every single community, regardless of whether you're private or public. It doesn't really matter. We're essential in terms of the health and the well-being of our communities, and let's do it.
Essential, non-essential, as I've heard somebody say. Hey, I got one more question for you, Teresa, before we jump off. I'm curious, you mentioned a couple of good examples, but what communities are doing really well to break down the barriers you mentioned? Give some examples we could send some people to look into.
Yeah, depending on what size you want to look at, I just mentioned some of them as examples. Those communities that are incorporating we call them a healthy communities master plan, where they're working together, like in bringing public health and parks and recreation together. And so in not just doing, I mean, I love the public health plans, you know, and they're crucial and they need to be done, you know, community health needs assessments and those types of things. But I really truly believe that a parks and recreation system plan, if you do those together and bringing the healthy communities elements in. So if you want, I can go back to the slide. I showed about 10 of them that I know have already incorporated that. It's growing. So the communities are doing well. Fruita, Colorado is doing an amazing plan right now. It's a small town. Hutchinson, Kansas, Arlington Heights, Illinois, Bloomington, Indiana did a really cool plan. South Bend, Indiana, because of, we used to work with Indiana University. They were actually kind of the forefront with Dr. David Compton in kind of combining these two elements. And so it kind of started in Indiana, and then people around the country have gone, wait, I want that. And so one by one, as communities do these plans together, and they recognize we've got to combine public health with outdoor recreation with our overall recreational needs, those communities are seeing it thrive because the decision makers get it.
This has been so helpful, Teresa. I just, as a participant who's watching this thing, I'm just grateful I can go back and watch this again and just kind of like have a chance to you know, watch this as a recording and pause it and take notes. I think there's just so much incredibly helpful information that's being brought forth today. And these are deep cuts. This is not like shallow stuff, basic information. Y'all are really diving into, you know, analysis that's taken decades to build. And you know,
I always err on providing too much, you know, because I don't have any idea. We've got so many different types of viewers here, and I don't know which thing is the most important for all of you. But if you need more information on anything, please don't hesitate to contact me. I'd be happy to help. And
that's the fun of this conference, right? It's the Outdoor Economy Conference. It's not the Outdoor Recreation, you know, Parks and Rec Program Conference or the Outdoor Industry Conference or the, you know, Outdoor Media Conference. It's all these things together, right? It's all the support people that make it possible. It's all these different pieces. And so bringing that broad perspective is what we're really hoping for. So thank you for bringing that and really being such a dynamic thinker in this world who's driving the field forward. We're really lucky to have you. And just so glad you could join us today. And so we're gonna pause for reflection now. We have about 5 minutes for a little reflection, for everyone to kind of just take all this stuff in. You know, what are those things you want to be thinking about going forward as you're doing this work in your community? So again, Teresa, Dr. Penbrooke, thank you for joining us. And
thank you very much.
Absolutely.